In this video, we're going to cover the basics of data visualization and why it matters in medicine. Data visualization refers to how we display data visually so that it becomes easier to understand and interpret. In health and medicine, you'll encounter data constantly, whether you're reading research articles, reviewing clinical data, or communicating information to patients or colleagues. Data visualization is simply the process of transforming data into visual formats like charts, graphs, and maps. Instead of looking at long tables of numbers or text, visualizations allow us to quickly see patterns, trends, and potential outliers. In clinical and research settings, this is especially important because datasets can be large, complex, and time-sensitive. Well-designed visuals help simplify this complexity and make findings clearer, more persuasive, and easier to communicate to others. Data visualization plays a critical role in medicine because it supports faster and more informed decision-making. A clear visual can highlight trends in patient data, such as changes in vital signs over time, that may be missed in a spreadsheet. Visualization also helps us communicate effectively with very different audiences, from other clinicians to patients to policymakers. Another key benefit is that good visuals reduce cognitive load, meaning they make information easier for the brain to process. In a field where decisions often need to be made quickly, this clarity can make a real difference. Health data comes from many different forms, not just numbers. Quantitative data includes things like lab results, vital signs, and medication dosages, anything that can be measured numerically. Qualitative data, on the other hand, includes patient interviews, clinical notes, and observational assessments. While qualitative data is less straightforward to visualize, it can still be summarized using counts, categories, or themes. Common sources of health data include electronic medical records, clinical trials, and epidemiologic data sets. Understanding the type and source of your data is an important first step in choosing the right visualization. Effective data visualization follows a few core principles. First is accuracy. This means avoiding distorted axes or misleading design choices that could misrepresent the data. Second is clarity. Visuals should be clean and simple, without unnecessary decoration that distracts from the message. Context is also essential, so axes, units, labels, and data sources should always be clearly provided. Finally, ethics are especially important in medical data visualization. This includes protecting patient privacy and being careful not to overstate or misrepresent findings. Visualizations are powerful tools, and with that power comes responsibility. There are several common chart types you'll see frequently in medical contexts, and each serves a different purpose. Let's look at just a few of these types and how to use them. Bar charts are versatile and easy to read. They're great for comparisons, like which department sees the most cases of a specific condition, or the prevalence of conditions across age groups, or number of patients by diagnosis. Line charts help reveal changes, patterns, and trends over time. Even small fluctuations become more obvious when visualized. Line charts are good for things like tracking glucose levels over time or hospital admissions by month. Scatter plots help answer, are these variables related? In medical research, correlation analysis often starts with a scatter plot. For example, you can use a scatter plot to look at BMI versus cholesterol or age versus reaction time. Histograms are great for understanding distributions, especially helpful in identifying outliers or skewed data. You can use them to visualize age distribution of a clinic's patient population or the distribution of a lab value like blood pressure. Pie charts are useful for when you want to show how a whole is divided into parts. They work best with a small number of categories and when the goal is quick understanding, not precise comparison. In health data, they're often used to show proportions, such as causes of hospital admissions, insurance status, or vaccination coverage. Pie charts are especially effective for summaries and storytelling with non-technical audiences. Choropleth maps use color or shading to represent variations across geographic areas. Public health heavily relies on mapping to track the spread of a disease. You can use them to show disease prevalence in certain areas or poverty levels. However, you can also use them to show spending variations among departments in a choropleth grid map. Let's look at some design basics and key points in interpreting visualizations. Color and design choices play a major role in whether a visualization is effective or confusing. One of the most important considerations is accessibility. As many as 8% of men have some form of color blindness, which makes colorblind-friendly palettes especially important in medical visualizations. Limiting your palette to 3 to 5 colors helps prevent cognitive overload and keeps the focus on the data rather than the decoration. It's also best to avoid three-dimensional effects and unnecessary visual embellishments, which can distort how values are perceived. Finally, consistency matters. Using the same colors, fonts, and styles across slides or charts makes your visuals easier to interpret and more professional. This image is an example of how a visualization can become too busy when too many colors are used. While color is meant to help guide the viewer's attention, excessive variation can make it difficult to identify meaningful patterns. In medical data visualization, clarity should always take priority over visual complexity. When in doubt, fewer colors and simpler design choices almost always improve comprehension. Not all visualizations tell the full story, even when they are technically accurate. When interpreting a chart, it's important to watch for truncated axes, which can exaggerate small differences. Cherry-picked time ranges can also be misleading, especially if they exclude important context. Always consider the sample size and whether proportions or areas are being used appropriately. A good habit to develop is to slow down and ask yourself what the visualization is actually showing and what it might be leaving out. Let's look at this example from a COVID-19 dashboard that tracked global new cases and deaths. At first glance, the chart suggests a dramatic spike in new cases around December 10th, 2021. However, this visualization lacks important context. The increase may reflect increased testing before holiday travel, changes in reporting practices, or testing requirements imposed by states or airlines. Without annotations or explanation, viewers may interpret this as a sudden and unprecedented surge in infections. This kind of presentation can create unnecessary alarm or undermine trust in the data. Adding annotations, trend lines, or moving averages would help viewers interpret daily fluctuations more accurately and understand the broader pattern. This slide shows another example from the same dataset, focusing on state-level data for South Dakota. Here, the visualization quality is limited by how the data is represented. The bubbles on the map are not scaled proportionally or normalized by population, which can cause viewers to overestimate severity in some counties. Overlapping bubbles also obscure smaller counties, reducing geographic clarity. Additionally, the graph showing 0 new positive cases could be misleading if it reflects a reporting delay rather than an actual absence of cases. To improve accuracy, shading counties instead of using bubbles and clearly annotating data limitations would reduce the risk of misinterpretation. You don't need advanced programming skills to create effective data visualizations. Beginner tools like Excel and Google Sheets are widely available and can handle many common visualization needs. For research and more advanced analysis, tools like R and Python offer powerful visualization libraries, such as ggplot2, matplotlib, and Seaborn. Tableau is another popular option for interactive and professional-grade dashboards. There are also free tools, such as Tableau Public and Canva, that allow you to create visually appealing graphics without coding. As you move further into research, learning more advanced tools becomes increasingly valuable. Data visualization plays an important role outside of the classroom and research papers. In real-world settings, visualizations are used to inform public health decisions, guide policy, and communicate risk to the public. The next few slides show well-known examples of how visualization has been used to communicate health information at a large scale. You may recognize this visualization from the Johns Hopkins COVID-19 dashboard. This dashboard became a widely used public resource and was frequently referenced by news organizations and policymakers. Its strength lies in its clear layout, frequent updates, and ability to show trends across regions. This is an example of how effective data visualization can support public understanding during a health crisis. This bar chart comes from the CDC and shows a timeline of infant botulism cases linked to contaminated infant formula. The chart clearly communicates changes over time and allows viewers to quickly identify when cases increased. This is a good example of matching the chart type to the question being asked, in this case, how cases changed over a specific period. This choropleth map from the World Health Organization shows the percentage of positive influenza A cases during a specific week. The use of color helps communicate geographic variation in disease burden. When designed well, maps like this can be powerful tools to identifying regional trends and guiding public health responses. There are many excellent resources available to help you improve your data visualization skills. Organizations like the WHO and CDC publish visualization guidelines that set strong standards for health data. Online learning modules, such as those focused on data visualization for clinical research, can help deepen your understanding. YouTube tutorials and visualization style guides, including Data2Viz and the Data2Viz project, are also valuable references. Like any skill, visualization improves with practice. To summarize, data visualization is a powerful tool in medicine. When designed thoughtfully, visualizations can reveal patterns, support decision-making, and improve communication. By following a few key principles, you can create visuals that are both effective and responsible. Thank you for taking the time to watch this presentation. I hope this overview has helped you better understand how data visualization can support your work in medicine, whether you're interpreting research, analyzing clinical data, or communicating information to others.